Most women who seek me out aren't asking for dramatic change. They should think about this as having the potential of being a series of operations over a lifetime, not just one.
Do implants last forever?
I think this is a critical question. Complications are not uncommon and they can significantly affect outcomes.
Kia ora, and welcome back to the Cutting Edge Plastic Surgery podcast. Today we're discussing a procedure that's widely known but often misunderstood, breast augmentation, also called breast enlargement. For some women, it's about restoring volume lost after pregnancy or weight change. For others, it's about balance and proportion, bringing the breasts into line with the rest of their body. To explain what breast augmentation actually involves, how decisions are made, and what women should realistically expect, I'm joined by specialist plastic and reconstructive surgeon, Dr. Adam Greenbaum. Adam, welcome.
Hi, Nicola.
Adam, when women come in to talk about breast augmentation, what are they usually hoping to address?
Most women who seek me out aren't asking for dramatic change. They usually talk about loss of volume or asymmetry, or just a feeling that their breasts never did or currently don't match their body shape anymore. So that can happen naturally with aging or after pregnancy and breastfeeding, or for example, following drastic weight loss. Women who've read my bio and sought me out usually also have it in their minds that what they want their breasts to look like is to be natural, rather than having an unrealistic operated look. For many women, it's not about size in isolation, it's about proportion and balance.
So what exactly is breast augmentation?
Breast augmentation is a surgical procedure that increases breast volume using implants. Silicone gel implants in my practice. They're used to restore and enhance volume while maintaining natural shape and proportion. It's important to understand that breast augmentation isn't an operation primarily designed to lift the breasts. Augmentation adds volume to the breasts. So if breast droop or ptosis is present, what I'll need to do is discuss a breast lift, either instead of or in addition to implants.
It's really good to be able to understand that difference. So what types of implants are used?
Well, implants have either silicone or a polyurethane shell around a filling of saline or silicone. I happen to have one here. Implants have either a silicone or a polyurethane shell, and that surrounds a filling which is made either of saline or silicone, which is formatted as a gel. So this is not dissimilar to a jelly baby. If you cut a jelly baby in half, the two halves would hold their shape. And it's the same with this implant. If you look at how I hold it, it's still maintaining its three-dimensional structure. If you lay it flat, it's likewise holding its three-dimensional structure. I use silicone gel implants, just like that one. And they're designed to feel natural and hold their shape. Now, they'll come in different shapes, different profiles, different sizes, and that allows us to tailor the implant to the individual's anatomy. Choosing an implant, it's not about picking cup size, it's about matching the implant dimensions to the chest width, to the tissue quality of the person concerned, and also to their lifestyle, whether they exercise a lot, run, and so on.
So this is where people often feel overwhelmed. How do you guide implant choice?
It's one of the most important parts of the whole consultation process. Having discussed with them what it is they're after, I then look at the chest width and breast tissue, the skin quality and the overall body proportions. And then the patient and I will talk about their lifestyle, exercise, work, long-term goals. Again, rather than aiming for a specific bra size, one's focusing on what will look balanced and sustainable for that person. So I encourage patients to take their time. This isn't to be a rushed decision.
And where are implants placed?
Implants can be placed either under the breast tissue directly and above the muscle, or partially under the chest muscle in what's called a dual plane technique. And that means that the implant is placed in one plane below the chest muscles, and then the skin and soft tissues are redraped to suit that newly augmented breast mound. The technique chosen will depend on individual anatomy and goals. The incision is going to be placed in the breast crease, to keep scarring as discreet as possible. And technique matters. Implant position affects not just appearance, but long-term outcome and comfort.
And what should patients expect on surgery day and during their recovery?
Breast augmentation is performed under general anaesthetic. Most patients would stay overnight for comfort and monitoring. After surgery, it's normal to feel tightness across the chest. particularly if the implant is placed under the muscle. Pain's usually very well controlled, and in fact, it's not usually painful so much as uncomfortable. Women who've had the surgery would return to light activity within a week or two, but strenuous activity and upper body work, that really needs several weeks break.
Do implants last forever?
I think this is a critical question. Breast implants are long-lasting, but they're not considered to be a lifetime device. They don't need to be replaced on a schedule, but they should be monitored, and patients must realize that if implants are placed once, they will need to be replaced, and possibly several times over a lifetime. So they should think about this as having the potential of being a series of operations over a lifetime, not just one. I emphasize long-term follow-up and encourage patients to stay engaged with their breast health.
And who tends to be a good candidate for breast augmentation?
Women who are non-smokers in good general health and, importantly, without an autoimmune condition, ideally without a maternal family or a personal history of breast cancer. They should have stable weight and, importantly, have realistic expectations. It's also important that patients understand both the benefits and the limitations of what implants can achieve for them. And similarly, that the procedure does come with complications. They're not uncommon, and they can significantly affect outcomes.
So what defines the cutting-edge plastic surgery approach?
I take a quite measured, methodical and detailed approach from the point we start consulting right the way through to follow-up. Consultants are detailed and unhurried. I like to see patients several times if necessary before we decide on surgery. That way, the first consultation is for a fee, but subsequent pre-op consultations are free to encourage patients to ask as many questions as possible and thrash out all the details. The surgery is based on anatomy, safety and long-term outcomes rather than fashion trends. I suppose as a specialist plastic and reconstructive surgeon, my training involves both routine cases and dealing with complications. And that's essential when you're placing implants into a body.
So to wrap up, what are the key messages for our audience?
I'd say breast augmentation is about proportion, not just size. Implant choice should be very individualized. It's about having long-term planning and follow-up. That matters very much. And patients' awareness of implant limitations, possible complications, and adverse outcomes, and specifically the links to autoimmune disease, that's paramount before surgery. So if you're considering breast augmentation, the critically important step is a thorough consultation process.
And our audience can learn more or book a consultation at ceps.nz.
Absolutely.
Dr. Adam Greenbaum, thank you for joining us.
It's my pleasure, Nicola.